I was watching.
All right, I'll call the September 7th, Human Services meeting to order. First, on the agenda is public comments. Do we have anybody from the public that wants to comment? Anybody on Zoom?
Chris is with us on Zoom.
Okay.
I don't see that she's,
Nobody from the public though?
I don't see anybody else.
All right.
There is one, Mike Norton's
Oh,
on
Norton.
us as well.
All right. Anybody on Zoom from the public? Seeing none, then we go with the program, behavioral health, overview.
Basically, it's gonna be Heather Faust, our behavioral health manager, and Emmy Steyer, our assistant behavioral health manager, are gonna give you a quick summary of behavioral health. We're kind of going through the divisions, and
Right.
each month we're gonna try to like update you on like a little more detail on what each division does.
I'm Heather. I'm Tammy. So, behavioral health is actually Human Services' largest division. We have over 100 staff, so about like 104 positions on the table of organization. We also have 10 relief staff that aren't on that table that help to fill in and cut down on overtime costs and things like that. We have 6 different locations now that we have staff based out of, so we have our Oshkosh and Neenah clinics, we have our crisis center, we have a diversion program out of Warren King, we have a staff at the jail and one out of the police department, and then we also recently, this isn't even included in that, opened a drop-in center that we had shared a little bit with you guys about in the past. So. What's that?
Could you remind me what the drop-in centers are?
Oh, so sure, so that's the State Street Center. It is really for some positive socialization for clients that have substance use disorder or mental health disorders, and it's a good supportive place to go. They can go hang out there. Many of them are also our clients, although it's not necessarily. Okay, but yeah, that's been working out really well, really positive. In just running a quick estimate of numbers, we have served, it looked like just under 5,000 clients in 2021 in our behavioral health department. Now, those are unduplicated, like individuals. So many of them we've served many times and ongoing, like for the whole year. But that's just the distinct number of individuals that our department had served, just running a quick estimate for 2021. So just an idea of that. Our certified behavioral health clinic in Oshkosh and in Neenah, we have psychiatrists, we have nurse practitioners, nurses, psychotherapists, and substance use disorder counselors. So we try to provide real comprehensive array of, whatever somebody needs and come and meet their needs together. We hired an intake specialist just recently this year to also help get people some immediate service when they walk through the door. We make sure they're kind of doing a triage, get them to the right place, get them to who they need so that they can get the quickest and most efficient services. Then we also have 2 teams that work intensely with youth and their families, primarily in their homes and out in the community. And those teams consist of psychotherapists, substance use counselors, and case managers. And referrals for that team come from the child welfare division, from schools, and from some other providers out in the community as well.
We also have 2 case management teams that work primarily with adults with severe and persistent mental illness. We have a team in Oshkosh and a team in Neenah. They follow individuals to try to keep them in the community, kind of help with those unmet needs. Each individual has a little bit different intensity level and a little bit different need. But they do whatever they can to keep them in the community, provide that additional support. Also part of those teams, there are some two peer support specialists that also can share kind of their journey, how they got to a place where they're able to be a peer support specialist and give back. We also have mental health technicians as part of the teams where they go out into the community after hours and on weekends and will do things like make sure somebody's taking their prescribed medication, or somebody was having a bad day during the day, they'll go in later that night just to check on them to make sure that they're doing okay, that they'll make it through the night. Our hope is to keep the individuals in the community out of the hospitals, out of other higher level settings. We also have two teams at the crisis center. The crisis center is over by Parkview. That is a 16-bed CBRF, which is the community-based residential facility. And that's licensed through the state. And then we also have it licensed for the crisis bed piece of it. So the one team really oversees that, the house, oversee the residents where they do, the admission paperwork for individuals coming in, staying there, their discharge, check in to make sure all of their needs are being met. They also answer the 24/7 hotline. So we have a crisis hotline that's run out of there as well. The other team that's based out of the crisis center primarily is our crisis team. They're the ones that you probably typically think of when you think of a crisis worker. Go out into the community and assess individuals, find out if they're safe to return home, could be possibly diverted to the crisis center, or best case would be that admission to a psychiatric hospital. They follow the individuals through the court process, work closely with Corporation Counsel, all of our other hospitals, and a lot of other contracted agencies and other providers in the community. Also part of that team as well is we do have a project position with the co-responder with OPD. So one of the crisis workers is stationed out in the police department and works jointly with the behavioral health officer. She does also fill in if the officer is out, or if she can, she'll fill in for other needs as well if the other crisis workers are busy as well. Our last team that we have is our clinical diversion team. This team is based out of Warren King. They just recently, talked about that at an earlier meeting, they just recently moved to the first floor of Warren King building. This team supports individuals that have a diversion to prosecution, or have a bond condition. They could be in teen court, drug court. We recently took over the 24/7 drug and 24/7 alcohol programs from the sheriff's department. The goal is to help link individuals with whatever their unmet needs are. So the case managers that would work with them would meet with the individuals, find out what their unmet needs are, and help get them linked to those services. We're starting to actually bring some of the other providers right into that space as well. So Department of Workforce Development, for example, so we have individuals that are looking to get employment. They're coming right to the Warren King building. We'll meet with the individuals, help get them set up then with the job, or whatever else they need. We try to get them linked. We just had somebody help somebody jumpstart their car so they could get to work that day. So also out of that team, there's a peer support specialist who she primarily does a lot of work with drug court participants. And then there's a substance use counselor that's right there who will do assessments for individuals with substance use concerns. And then that team also has the substance use counselor that's out at the jail. So we work closely with the jail as well to try to help individuals that are incarcerated so we can get them linked up with services once they leave, help them get their insurance applications set up so they can get medical assistance once they leave, or get set up with whatever other services they need. So that is our behavioral health division. If anybody has any questions, we tried to kind of go through it fast.
Any questions? Go ahead.
Just a comment, Mr. Chairman, that I feel honored to be on this board. And I'm so proud of the work these people do
Mhm.
day after day after day after day. Thank you.
Thank you.
How long have we had, did, I don't know, crisis worker go around with the Oshkosh PD?
This,
This year,
Yeah, I was gonna say this year,
this year it's first starting.
I know, so we haven't started yet, did we?
in about, March, she started her position. OPD started their behavioral health officer last October,
Okay.
in his role, and then the crisis worker joined in March.
Because that's a position that I'd like to, us to try to keep track, I mean, statistic wise.
Mhm.
I mean, because that was the one that we fought for a while, we got that from NACO, National, County Association, because other counties around in other states do this. And we were saying, this is something that we need, and so we finally got that position in, so that's one that I hope that we kind of keep track of, that one.
It's been interesting.
Yeah,
So there's, two different agencies that have the same end goal, but
Yeah.
have a different approach.
but if we can keep people out of jail, I mean, that's
And
the
it
big
has
thing,
been. Yep, I think it's been pretty great too. I think, some of the more powerful feedback I've gotten to are, especially working with some of the youth as well.
Right.
And coming in with that trauma lens, I think, even some of the officers have been impressed and
Good.
excited to see that different approach and how well it can work for an individual that might be like out hiding or, a crisis
Exactly.
worker. Or-
Well, the big thing is we were trying to, stop the mentally ill, from going into the jails if we could, because these people would be able to identify that better and, and do that. So that's one of our main goals is to keep the people with some kind of mental illness, get locked up all the time. So,
Yes, exactly, because that's
yeah.
not a great
Yeah.
place. for them.
And the other one I'm proud of that we got is that, that AODA went into prison, or that, that follows up with them, because, I mean, that was the other big thing that we fought for, because otherwise, I mean, people were getting released from prison or from jail or whatever, and just saying, here you go, down in the streets, with no kind of backup, no plans, no, follow-up, out there for them. I'm glad we're doing that. That's was the other big thing that this committee kind of fought for too. What? Any other questions on that? Thank you for all the work that you do. All right, then we'll go on to approve minutes of the August 1st, 2022 Human Services Board meeting.
I would just like to make a comment on the minutes that, they were sent to you, and I did not notice that there was a correction in there are 13 county vehicles, not 30. So that correction has been made, but it was made right after I sent it to all of
Yeah, I
you.
see that.
If you'd like an updated copy, I'm more than happy to send you a copy, but just wanted to point that out.
Yeah, we have 13 now.
13, not 30, yeah.
Correct.
I don't know where we put 30.
Okay, I entertain a motion with that correction.
I move to accept the minutes as presented with that correction.
Second? Any discussion? All those in favor say aye.
Aye.
All those opposed? All right, then we will accept the minutes of the August 8th, 2022 ADRC committee meeting and the August 9th, 2022 Specialized Transportation Council. Okay, a motion to accept?
So moved.
I move to accept the ADRC committee meeting.
Okay. Any discussion? All those in favor say aye.
Aye.
All opposed? Ayes have it. Inpatient and institution placement.
So it's our graphs again, you can find that, or just a sheet of 3 pages of graphs.
So we don't have anybody in correctional, you know?
So these are through July.
Okay.
This is through July. And, it will be reflected, I think in next month's, we have one person in.
It was actually placed in July, but we haven't been, still for it.
Right,
Or
we
yet?
have the bill for it.
Yeah.
So, it's a young man who had to go to Lincoln Hills and, also as a follow-up, some of the folks who go to Lincoln Hills, have to be, also involved at Mendota mental health treatment if they have subsequent psychiatric issues and, the particular person that we're talking about did, and so, they're really actually receiving services at Mendota right
So
now,
that-
but it's a placement at Lincoln Hills.
Right.
They determine the location at this point.
So he's right now at MJTC.
Yeah,
in
but it's
Mendota.
still a correction.
Well, yeah, it's still correctional, yeah, yeah.
So anyway, so we're gonna have one in there for the first time in, what's the year? 2017. So, hopefully, we'll keep it, an eye on, usually the placements last up to a year. It's possible that it could go all year long, so about middle of next year, but it's also possible that this time may be shortened if things go better than expected, and so we can get them out sooner than that. That's the only change on that first graph. Second, the bottom of page one, child welfare, residential care centers. They're doing really well there. Update on Missy, you want to give us an update on Missy?
We're still progressing because she, will be, 18 in the near future, so we're working with actually people from that state to, transition her into adulthood, and then that's still going, through the process, and she's doing well there. Yeah, as of right now, there's a lot of things, you still have going on, trying to figure that out. We will go where she wants us to go at the end of the day, and, or her guardian. She's doing well while she's there, going really feeling safe with that group, so she would be great.
And of course, we're not using the person's real name, it's a
Right.
fictitious name, we're just kind of identifying her so that those of us who have been kind of wanting to know how she's doing, and we're able to tell you without revealing any confidential information.
And you guys know the story on this bill, right? Getting out of state only because we could not find anything in this area that would take her, so that's why we had to ship her out
It's the first time we've ever had to place anybody out.
of state. Okay.
Okay, so page two, now we move to inpatient, top graph on page two is the inpatient specialty hospitals for adults. And, what I note about the adult placements is that they are, so far this year, pretty significantly higher than last year, and preceding years. We're still researching, you know, obviously, we're trying to find some causal reasons why these numbers are higher. Are they higher because there's just a larger number of people that haven't come to our attention before that need our services? And again, the way this works with hospitalizations is if the person has no ability to pay or has Medicaid, we have to pay that charge because Medicaid does not cover for placements in what we call institutes for mental disease. And in most cases, we try to find a placement that Medicaid will cover the cost, but there are so few placements now in hospitals that almost all the time they end up going to Winnebago Mental Health Institute or to Fond du Lac's Health Center, and both of those places do not accept Medicaid, or Medicaid can't be billed for this for the time. So we end up paying the full freight for that, and then if at some later point, we keep them on the books and we assess them a charge, and they have to start paying us back as they have the ability to pay. And we probably keep those books open for, and I don't know if Jen is here. How long do we keep the books open on repayment? How long?
Prepayment.
Like, if we're gonna keep the books open for somebody who needs to repay us.
Pay back.
for hospital
10 years.
payments.
Is the cost still about $1,200 a day?
It's 1259 this year, it's gonna
$12.59.
be 1350 or so.
So it's $1,300 a day next, yeah. coming up.
So it's expensive line item, and that it's in Heather's budget. So
You
we're
have a
gonna,
lot of people that pay within those 10 years?
Um,
Not really.
Not really.
yeah, in the 30-some years that two counties, I mean, let's say we spend millions of dollars, we probably get a few thousand back, maybe a little better than that, but not, you're not getting the entire amounts back. These are not people who generally are able to hold on, regular jobs and, and so it's hard. And what we do is we attempt to keep it on the books and make a good faith effort to get reimbursement. If we don't, then we end up writing them out. That's our, it is in state law. This is what we have to do. So it's part of the obligation that we take on as a county department to pay for the service.
Where you got, so I understand that now. You got medic, what age group is this for these?
I'm really talking right now about adults.
Adult.
Or 22, in Medicaid, an adult starts at 22 and goes to 64. And then Medicare kicks in at 65. So Medicaid, so between 22 and 64, at these institutions that we have to place people at, Medicaid doesn't pay a dime, it's disallowed from doing that.
I thought you said like, we try to find places that'll take Medicaid.
Okay, so private hospitals, so
Right, place
okay.
for
if there's a psych unit
They need
at Mercy, there's a psych unit at Mercy, there's a psych unit at St. Elizabeth and Appleton. There's
Theta Clark have them, yeah.
yeah, Theta Clark. So if we can get a person into one of those three institutions, then Medicaid will come. So we'll go try those first. But if they say they're full, then we're out of luck, and then we're back to, Winnebago becomes our last
Last resort.
So they're forward for the terms.
And a lot of times they are.
They are.
Winnebago's our last resort. We got no place else to put them.
And you don't have a choice, we have to.
No.
Write it up on the
Yeah,
book.
believe me, if we could find a payer first, that's what we do. We try to find the payer first. And when there's not available, then we go to.
Yeah, because most of these go in as emergency detention, that's why.
So
And the
these-
police, if
these-
the police take them in as emergency detention, we have no choice to put them somewhere.
So these 4 or 5 are. We're paying or are they on Medicaid?
All of the ones that we're reporting here are the ones that we're paying.
So we couldn't find them.
Right, we couldn't find it.
Okay.
Sometimes they work with other long-term care agencies as well, and they don't have good homes that they can place individuals in right now. I know we just finally had one person leave today, Winnebago,
Yeah.
and you try to put some pressure on them as well because they have to find that alternative living site, but they struggle because
Yeah.
if somebody needs a 2-on-1, so they need 2 staff to work
That's-
with
that's
one
tough to find.
individual, they aren't finding staff to do that, and then sending individuals out too soon back into the community, and then they get attacked, and then those staff end up quitting, and going into
Yeah.
working at Target or something, so there's been a bit of an exodus. I think that we see that as well in long-term support, is that it's difficult to find
It is.
placement for high-need individuals.
And like you say, Winnebago's their last resort, and Winnebago can't turn them down. I mean, saying needs, if they don't think they're adequate for them, they can just say, we don't want to take them.
Correct.
Even though they have a bed, Winnebago is their last resort. I mean, they have to take them.
And then is Medicare paid for that?
Nope.
So either way.
Either way,
We've been there.
Whenever an institution on state, we have to pay.
It's not a great situation here, because we have to pay what we have required.
That's why,
So
we-
on the
that's why
books
we do everything but try to keep on it, please.
So what we try to do is try to catch anybody as early as possible. We try to provide alternatives to having to go to the hospital. That's why we have crisis center. Because
Right.
hopefully we can work some people that don't absolutely need that level of care. We can move them into the crisis center. Maybe we can stabilize them in their own home. We do a great job, but you're seeing the results of when either that person is unknown to us and they've never been in the system before. They'll come in, we don't have any say about what we're gonna do with that. And also, the other one is if they're known to us, but we don't know that they're struggling, maybe they haven't seen us for a while, we haven't had a connection, and then they get, to the point where they need to go to the hospital, then we end up with a bill. So hopefully, we're catching even people that we know about, and we can't do much about the people.
That's a question, I'm only asking question because
That's fine.
I made a mistake and didn't ask question before, so when I.
That's cool.
That's fine.
So, and then, you know, you look back at history, which history is history.
Yep.
And then now this year, it seems like, maybe it's pandemic or not, but what would you say the one or two extra people are coming from? Is it pandemic or, because you're doing a lot more there?
That's what they're gonna try to figure out.
Yeah, well, we're gonna try to figure that out, but Heather just gave us part of the answer. Okay, part of the answer is that, and this is a complicated answer, but back 10 years ago, the state of Wisconsin took some service elements away from us and gave them to family care entities. So, Lakeland is our closest family care entity. There's another entity called Community Care. And what the state did was they said, here, you can take what the county used to do and just, you do it and do it cheaper and better, okay? But what they didn't require them to do is one thing they always required of us, which was if a person needs to go to the hospital from their little group, then we were always, when we had it, we were required to do what we do now. But they never took that responsibility and placed it upon the long-term care entities or family care entities. So what Beth was alluding to is that here, this person's in family care and getting services, and all of a sudden, they've got some behavioral issues, they've got some issues maybe related to dementia or something else, and they say, oh, we think this person has a psychiatric illness. So they send them to Winnebago, and Winnebago maybe treats them for 3 days, 5 days, 10 days. Winnebago says they're good to go. And these entities say, but we don't have a place to put them in because we don't, they maybe have bombed out a replacement or whatever, now they gotta create a new one. And so that person ends up sitting at Winnebago in an untreated status, and we continue to pay the bill until they find a place. And we have complained about this, we have taken it to the highest levels of the state of Wisconsin, and basically, essentially the reaction from the state is too bad. So they have not given us any relief on that. We've complained about it for 10 years. I'll tell you, it's one of our number one priorities as counties to get this thing resolved, because they just let people sit. At Winnebago, at a very expensive, soon to be $1,350 a day, no treatment, and we paid it up. Well, they are taking their time trying to find a place.
Well, they're responsible for them.
So, and none of us around this table have the power to get them.
Well, I'm working on it a little bit.
Although, are you?
I'm on Lakeland Care Board.
Okay,
So I am working on it. I'm pushing it
Okay,
from my side a little bit.
so anyway, so I think that's a couple of people in this list.
Yeah, and that's tough when you go to Winnebago and Lakeland Care won't pay. We get to pay.
So if we
Makes
remove, would you think it's 2 or 3, right? Is it 2?
I would say at least two.
At least
Okay.
two Lakeland
So if
Care.
we drop those numbers down, we would be at 2.5 instead of 4.5.
2.5, yeah.
So we would be more normal if we didn't have these 2 extra cases. So, what you don't see in this bar graph is how far back this went. We started doing this in 2008. If we actually had this whole thing going back to 2008, I think we're up to, when did we start this? Is it 2014?
2015.
15. So if you saw the all the way back to 2008, the numbers would be considerably higher. We got it down pretty consistently to where it is.
To 2, yeah.
And now we're bumping up again. Part of it can also be we're coming out of COVID and we're starting to discover more mental health issues. People are becoming more aware of them, and I think that could probably increase our costs as well. Because people are gonna say, I need some help. Whereas they didn't do it during the pandemic. They basically
We're
sheltered.
working.
So
What I was alluding to there is, this ARPA funds are all over, everybody wants their hands on it. And I always thought if this was an area that might have been COVID related issue. You're definitely eligible to take some of that money if you were to apply for it. But it didn't sound like it, like you said, they didn't really. Wasn't really.
I wouldn't say
COVID-related
that-
issue.
I wouldn't say that people would, it would be a direct correlation with COVID. It might be that now you know, the funny thing about mental illness, I was just commenting to Pam a little before the meeting, that it always seemed when I was doing crisis work way back in the day, that it seemed like when the weather got nicer,
Yeah,
when all of us would be like, oh, I'm feeling better now and I got more energy, that people who have mental health issues tend to do worse. And it just seems like, so I'm thinking, maybe we're getting out of the COVID thing a little bit, and maybe people are finally starting to get a little more energy, but now they're starting to see that they really got these needs that, you know, or they're coming to the attention of law enforcement or whatever. So, I mean, there's lots of things that can add into, can correlate with this. And it's just, our job, Heather and my job, is basically to try to figure out anybody on the list of these people that are in there. Can we retrospectively look back and say, is there anything else we could have done differently in order to make it so that some of these people didn't need to go? And that's we do this every month. We kind of go through an exercise of, like, is there anybody on this list that maybe we could have done better with? We could have caught it earlier. How will we do that? What else do we need to do internally to try to catch? So we're not ignoring it. We understand it's like, it's up there. We just don't want to ignore it. We want to do something about it.
Thank you.
There's
Thank you.
also, it also appears that there's no incentive for Winnebago or Lakeland to find placements for these people. There's no incentive. I mean, they're essentially creating a giant, if folks are sitting there untreated, then they're just padding their bank account at this point, because the county's paying for it.
We've done different things. We've asked the state, how about if you transfer whatever percentage of money you think is related, we could give you a percentage of people that have gone in. How about if we transfer our money to you and let them let them manage? You know, like they require us to manage. That they didn't want to do that. How about if you give them a penalty for every day that it takes, you know, for them to kind of, you know, get them incentivized to find a place to work quickly. No, we're not gonna do that.
yeah, if we could
So-
get them, if we could get Lakeland to do basically the same thing as the 980 law, where it says you have so many days to find a place, or you get fined so much per day. That'd be great, but we can't do that. It'd be great to do that.
Lakeland is a private entity.
It's a private
correct?
nonprofit.
Yeah. And Winnebago
Is a state
Mental Health
institution.
is a state institution.
Just so everything's clear though, when we're talking about this, there are 3 family care entities. It's Lakeland, like Bill said, Community Care and Inclusa.
Yeah.
And I do have to say that in my experience, they are, like Larry said, they are working with
They are
us better
working,
now. Lakeland hired a behavioral support
Correct,
specialist within
you're
the
right,
organization. They are better partners than ever right now. We've struggled with this, like Bill said, for a long time, and they are partnering between the caregiver crisis, which is significant. They can't find staff. We have agencies who are telling us that as of Friday at 5 o'clock, they are done working with someone. The caregiver crisis is a significant factor in this. So I don't want to make it seem like we keep talking about Lakeland, and I just want
Right.
to make sure that we're not blaming Lakeland here, because
Right.
they are partnering better with us. The caregiver shortage is
Right.
really significant.
Yeah, because Lakeland's gotta find the group homes and the places for them, and these places don't have the staff to work it. I mean, they just can't, they can't
I
take it.
understand that.
Yeah.
And there was a problem before.
Yeah,
And now the caregiver shortage has just magnified. that
magnify
problem
it, correct.
And made it worse for everybody.
I mean, yeah, I mean, because right now, I mean, most of our 2, major nursing homes, I mean, Bethel Home and Parkview Healthcare.
Yeah,
I mean, it's not that they can't take clients, because the clients are there, it's just they can't take them, because they don't have staff to take care of them. You know, and that's the
Yeah.
problem we're having right now, yeah.
and
I'm glad that
hospitals
the-
can't get people out either.
Yeah.
I'm glad that Beth clarified that.
Yeah.
You know, we're not.
We're not getting down on Lakeland because.
Yeah,
they're
it's-
doing- they're working.
And we actually work pretty well together. It's that when they don't have another placement, the reality is, you're asking us like, why is this number so high? We're trying to give you an explanation. That's partly why it's higher.
So-
And we're struggling with that, so.
How does that impact budget numbers going forward?
Well, right now, we're over budget. So, how does that impact it? we'll see what we need to do come November, if we need to go back and do a transfer or whatever we need to do. We'll ask for them if we need to. That's how it works. That's how it works in every county. If these big budget lines go over, you basically go back to the county board and explain to them why the numbers are over and why we need to transfer.
Transfer funds.
Okay, and.
Karen?
Oh, sorry.
I was just gonna address Ralph's question when you asked how many of these people are we responsible for? There are way more than 4.5 to 5.8 Winnebago County residents in a specialty hospital. But the majority of those people, if I had to go to a specialist, I have insurance, I won't show up on this form, and Dr. Topol brings us these forms. These are people we are financially responsible for. So in June and July, anywhere from 4.5 to 5.8 people are under our financial responsibility. So there could be 20 more people in Winnebago County in a specialty
We're
hospital,
not paying.
but we've got good insurance.
There are more people in taking it now. Yes.
So it could have been at that time when it was lower, there was more people that could pay for
Could
it.
have been.
Now it's gone the other way.
You
You
can
don't have
also say
insurance.
maybe there's more people on Medicaid, and then even if there's more people on Medicaid, this doesn't help our situation, but it's an exclusion, right? So that,
And seems to me it would be cheaper to rent a hotel room, hire three people for a 24-hour shift to watch those people, and to pay $1,300. You could get a hotel room and pay 3 salaries, far less.
It's over $2,000 a day to hire 2 people to be with somebody.
yeah, I wouldn't be so sure. I wouldn't be so sure that method is cheaper. Most
Yeah.
times it's actually more expensive.
I gotta work on this.
All right,
Okay,
special, yeah.
okay, so now the bottom row is kids. And again, look at the number is 0.5 and 1 on the graph. So even if the number is up to 1.0, it's still, still within the realm of, it looks like we're pretty average there. Okay, and then page 3, we actually are doing really well with our security detention placement. Overall, they've been down in the first 6 months of the year, so that's good. And in our foster care system, just a little bit of a reduction in the usual number. Although as Annette would tell you, it really depends on what's going to happen as to how busy we're going to be with foster care. That's changes every day. So we could go up again. And as I told this group many times in the past, if any number goes up on these sheets, the one that I would have the least problem with is foster care number, because foster care is generally a lesser cost and is a service that's closer to the family, where it's like the child only has to go to yes, has to be removed from their family, but is only being removed to another family who's going to be taken care of it as opposed to going to an institution. A good thing. So it's a good thing. So if foster care goes up, frankly, that's a good thing. So I'm not worried about it.
One last question. The boy, the boy who's just been sent for juvenile corrections.
Yeah.
If a child is sent away, and if there's a good relationship with the family, are they allowed to go and visit the child?
Well, sure.
Okay,
Yeah, they can visit. You can visit the corrections, yeah. Okay.
They actually up at Lake and Hills, they made buses available and different routes so that families who didn't have the ability to get up there on their own transportation, that there was a way for them to get transportation.
Yeah, and they got school, they're getting schooling up there,
I think once or twice a month, I think on a weekend, they do buses.
Let me make one last comment.
yeah.
I mean, looking through all this as a person that's never been on the board before that, and listening to all the information, when I first came here, I think I told you, I thought the pandemic reflected a lot. And so just taking the pandemic in and looking at this, that's an amazing job to keep it this low, even with something going on. And you hear from the public or news or whatever, but because of this, we have this happening, but doesn't show like you're, or you're taking a good job taking care of it. So I gotta give you credit for all that, because as an outsider, I thought these were gonna be crazy numbers, things are going high, we're gonna have results from it, but you definitely have it under control.
I did too. I mean, so
So
my
really,
reaction
you
to
know,
that, I did too. I thought it was gonna get higher. And I was wondering how we're gonna be able to help when so many of us were, you know, at home and we converted to going, a lot of our staff going to work, you know, a lot from home. And one of the things I asked of the staff, I said, you know, now that we're not gonna go out and see people as much in their home, I would like to set an expectation that you contact the families twice as much. That was just kind of a goal that I kind of had set out there, It's like, you know, so if you saw them once a week, I want you to try to reach out to them twice a week. And a lot of the workers did do that, and a lot of people said that was really helpful, that they were getting more contact from our staff. So I think that's part of the reason is we kept in very close contact with the families. And if they needed something, I know Annette was running around if the family said they needed some kind of supplies, or we did some kind of things for the kids to kind of help, kind of some educational gaming and kind of stuff that, you know, anything that the family said that they needed to try to keep the lid on things, as much as we could, we try to provide that to the families, to kind of help things stabilize and stay stable. Right? Annette?
Right?
Yes.
Even if it was like trampolines over there.
No,
We
not
did that.
no.
Not do the chairs.
Stop.
Well, great job.
All right. Janet, financial.
Okay, so you should have the financial report based on the July reports. As you can see, all of our expense categories and revenue are all showing favorable. Our bottom line projection at this point for our surplus is 3.96 million. The first page of graphs. We talked a little bit last month about the spike in expenses in June, which has now been followed up by the spike in revenues in July, because we submitted all of those expenses for reimbursement.
And it looks higher, it's not, revenue looks higher than the expenses.
Yeah, it's not, yeah, because some of our revenue, especially in like the CCS program, comes on a lag.
Yeah, I know.
So, yeah, there's probably be like that exact correspondence. The pie chart at the bottom just kind of shows where we're experiencing surplus, and you can see the pink slice is the biggest, and that's in our operating budget. The next page just summarizes our budgeted expenses and revenues by category against what we're projecting now for year end. A couple of things just to point out from July, the books for the county have closed, and our final surplus for the department for 2021 was about $4.3 million. We talked a little bit about the youth who's at Mendota Juvenile Treatment Center. That line item is going to go over budget because we have had 0 clients there for many years, so we budgeted at a very low level. Now that we do have someone and we know the cost per day is very high, we will be going over on that line item.
Any issues there, then fix the, this is from several years ago. Abuse and not good care, and it has been addressed.
Yeah, they've made some, they continue to have oversight by the federal government and the state, and they've made some significant changes. This individual is not actually at Lincoln Hills right now, and Mendota Treatment Center wasn't under the same, expectations and the same, court order. I'm trying to think of the name of what they were under, I can't think of it right now, but MJTC, the Mendota Juvenile Treatment Center, is different. But they have made, some pretty significant changes, what they're doing in corrections. But we still, as a county, don't, and as a division for sure, don't believe that corrections is the best place for kids, for youth to be, so we will do everything we can to avoid that.
I realize in some cases, there's no, like in this one, there was no option. But I also, no matter what the child did, I want to know that he's safe, he's one of ours, that he's safe.
Yeah, and that would be what we would make sure we do. And even in this case, I mean, I spoke personally to the deputy administrator of Thank you, Phyllis, to make sure that if this kiddo was gonna be there at all, that he would be treated as safe as possible. And that's part
We're
of why,
watching.
that's part of why he ended up at Mendota.
The only other thing, we always put on here what our prior year revenue is, because that is an unbudgeted revenue for the auditors, because we can never project what that's going to be. So right now, we're sitting at about $72,000. We added 11,000 in July for some economic support true ups for the year of 2021. That's really it for this month.
And just for the group, on revenues, and if you go back to this page and the revenue being real high here in the middle of the page. Also, the budget year for the state starts in July. So it runs from July 1st to June 30th, so it's the state budget. And what the state has done for several years now is they've separated the payments that they send to counties into two pieces. One we get in January and the other one we get in July. And that's just the way they want. They don't want to just give us like all of the funding in one crack, and the way they want to divide it up. So I would suspect too, Janet, if this is right, that I think we probably got some payments from the state or no.
I'm not sure they came in July, actually.
You think it's a different time? But
Well,
they do break it up.
They get posted in August.
Right.
We get that if we actually.
Oh, okay, so if we get it in July, we'd see it in August, okay.
Yeah.
Sorry. Disregard what I just got done telling you, but it is true that the state does divide up how they send us the money. And so there will be certain spikes in our revenue based on the fact that they're now giving us a certain allotment of, so that should happen in August.
We usually do see a spike in August as well.
Yes, another question.
Yeah.
On that 4.3 surplus now.
Mhm.
What happens? Or where-
That is not ours. It
Okay.
is in the general fund of the county. We do not have we do not have a reserve. We don't hold any of that back. It all goes directly into the general. So
Although,
it's now.
oh, sorry, there is actually, we're actually called the Human Services Fund, which is sort of a subsidiary of the general fund.
Right.
And the auditors want a certain amount of cash on hand in that fund, so they always do an adjustment as part of this year end, and they usually maintain about $800,000
Okay,
in that cash on hand.
okay, so there's some account, but most of what you're seeing there is not something that we hold on to. It just is a book entry into the general.
So to the new supervisor, this 3.9 is great. We kind of keep people living, kind of keep a hush on that. We don't want to get that out that we got this, because that's what supervisors every year when it comes to budget time say, you got this surplus of money, you must be over budgeting your thing. We're not. We just, human services is the one department that is tough to do a budget on, because you never know from year to year what your revenue and what your expenses are. And like Janet said, some of this, and Bill said, some of this money that we get from the state comes after the fact, and we don't know that it's coming. And they don't tell us what it's for either. They say, that's your money, but after we took our cut out of it, but we don't have to tell you what it was for.
Were you looking for something else on that question?
No, I just, in the short time that I've been here, I've heard a lot about surpluses and extra money, and on the health board, they do it a little bit differently from other stuff there too, when you see these. And I only had experience in car business, and we had kitties and funds just kind of like this, but I never saw a place that earned it or has it, it's theirs, but they don't get to use it for certain things. That's what's kind of bugging me a little bit.
Most of ours have always gone kind of back to the
Yeah.
general fund.
And I know that's the way it is, but you just look at all the needs that we need and things we do, and we have a kitty there, and then we got, like, I gotta ask my mom and dad to spend it. But I earned it, I worked on it the last 2 years and earned all that money, now I gotta ask.
Well, that's, and
Doesn't make
that's,
sense.
yeah, and that's why when we kind of talked of our budget talks that you and I and Harold and it was on, is that was one of the first things that you remember the county exec said to us in past years. Human Services has always been our whooping boy, and we've always taken money from there. This
He said
time,
he wasn't gonna
this
do it.
time they weren't gonna do it because we've kind of gotten into it, the exec's head
Yeah.
is that the human services budget is a tough one to predict. You might not always have these surpluses, it's just, we've been lucky on a few
I didn't
things.
realize that. I just want to
Yeah.
make sure that. That we get taken care of, because
Oh,
we
yeah.
earned that. I mean, why would you have that sitting there? And then you know it's going somewhere else. And I
Yeah.
think last year was it like 2 million or the year before, or something like that.
Well, we talked about
But that's
the,
what's important.
what, 6 months ago, 8 months ago, whatever, about having human services having their own fund balance, but, we
Not fun.
decided
It's not
to get-
fun. They're just working hard. They just need extra help.
Well, but
And I
I,
just feel bad when we're
Yeah.
sitting here, it's like, I don't know, it's just like my budget, I don't have any money in the bank and I have to go borrow it. But there's a couple of bucks here and I have lots of needs.
Human
Again, it's
services is
just
tough to
not-
predict.
again, for me, it's just that money should stay, some of it here to help the needs that we have, not just, oh, hey, goes to the general fund. And, I know we got a gas bag for it and all that stuff, but it just feels that you guys have earned it, worked for it,
We always make sure, that
and you know what I
make
mean?
sure we're on.
That's fine.
We did, so just to reiterate what Larry said. The board before you, before the elections of earlier this year, took it up as an issue, should we create a reserve fund? And put the money into a reserve fund. And the answer at the end of the day, when we researched it, was even if we had a reserve fund, we'd still have to go to the county board and ask for money from that other reserve fund. So in terms of the difference, whether we ask for a transfer when the money is in general fund, or we ask for money to be taken out of reserve, it would be the count to the same thing.
Same thing.
You still go back to the county board to ask for the money.
And I realize that, but if you have 800,000 in your bank and ask for the money out of your bank, as opposed that 4 million went to their bank, and how the county board thinks that their bank can do what they're doing, but you had the kitty for yours, you're asking for some of your own money. Which one is easier to ask for?
They still gotta prove it. They
Okay.
can still turn down our own
I
money.
know.
I mean, we can still say we want 800,000 out of our surplus, county board can still turn it down and say, no, we're not gonna give it to you. I mean,
Okay, but again, with the county, executive, they won't have,
right,
you shouldn't have that.
exactly.
Just wanted to. All
All right.
And I'm sorry I'm asking questions, but that's the way I'm.
No, that's fine.
And to me, things don't.
All right, gotcha. Any other questions on financing? Who's doing, Renee?
We don't have Renee, and I'm just gonna announce, I'm sure that she wouldn't mind, her mother-in-law passed away last Friday, and so she's out for several days, taking care of family business, and so that's why she's not here today.
All right, director's report.
Okay, my director's report, kind of short and sweet. I guess I wanted to report on our meeting with the county executive, for the budget that, pretty much it was accepted as we, had talked about it here back in June. A couple of things that changed, Janet, reported some additional revenues coming from different sources. The issue with having more money in the budget that you all talked about, putting some more money in the budget for Lincoln Hills for next year so that we can cover at least half a year. Janet was able to put that money in so that became a non-issue. So that was one of the ads that you had agreed on that you wanted to see happen, that was automatically accepted as, okay, that one's taken care of. We're still waiting to hear about the vehicle. I believe the county executive is planning on telling us which ones he's approving by the end of this week or next week, so we should know by then. Otherwise, there was a position, we're taking over the 24/7 alcohol program from the sheriff. And that program requires one case manager position and some additional funding for some tracking equipment for that program. And so we had asked for that to be put into the budget, and he accepted that. And I think we moved the money around so that we could.
And we figured out how much it really was.
So I think, Janet, we covered that, right?
Yeah.
Yeah.
Position. Okay.
Yeah.
So it's really just, we're waiting on the car, to find out whether or not they approves the van.
Our 31st star.
Our 14th, no, it will be a 13th. car that
13th
will
car.
replace
Yeah, another one.
One of the 13. There we go. Okay, the only other thing that I want to mention is, for those of you at the county board last night, you know that I presented to the county board of special orders on the shelter care. And now that I think about it, I'm going to make sure that each of you who wasn't at the county board, that you get a copy of my PowerPoint that I gave last night, so I'll do that. Make sure that we get everybody in PowerPoint. Basically, I just went over what the shelter care is, what the history has been around the shelter care, that where we are now is we're in a situation where we lost our only provider of shelter care service that we contracted for. Counties are required by law, I cited the sections in the law, that we need to have a shelter care facility or we need to contract for shelter care. Shelter care is part of the juvenile justice system. It's considered non-secure because kids can leave with supervision. They're not locked in there like a jail, but it's used for purposes of supervising youth on the juvenile justice system. Short term, they're there for usually 3 to 10 days. Sometimes can go as long as a month. And we can also use it for kids awaiting a higher level need of placement if we don't have one currently available. And we can also use it for mental health crisis for kids. So we have a perfect facility. It happens to be owned right now by Wisconsin Social Services. They couldn't run it anymore as of last November. We had to scramble. We found Outagamie helped us out for 7-8 months with keeping our shelter care kids there. We cobbled together another vendor agency was willing to help us develop staff. Right now, we are open again as a shelter care at the 2831 Harrison Street. But we don't own the building and we don't currently have full-time county staff running. We have put in the budget, as you guys passed with us back in June, that we're going to add those to the TO. If the county board approves, we're going to have the staff to run it. And the only last piece is that we need to purchase the building from Lutheran Social Services. And what I said is that Lutheran Social Services is interested in selling it to us. The building's been appraised. There's an appraisal out there. We were doing some verbal negotiations with them. They were willing to take a lesser rate than appraised value because there's some things that need to be updated. There needs to be a roof replacement, some other things happening at the building. So the whole purchase price, $700,000 for the building, $150,000 to do the repairs, and $150,000 to bring it up to the building code. So how this happens, so I tell you the process that's going to take place is that we need to have a joint meeting between this body and the facilities committee. So that's only happened very rarely in my experience, but we can have a combined committee meeting. I'm hoping that we'll try to find a time for the end of September where we can have this combined meeting between your two committees. And then we'll present all of the information to you with a resolution going forward to purchase the building. That's not ready yet because that wasn't what was required last night. Last night it was basically to just tell you kind of what's happening and why it's happening, what's going to be happening coming up. So if we can have that committee meeting the end of this month, which has yet to be determined, then if it passes there, we'll go to Personnel and Finance Committee on the 6th of October. And if they pass it, then it would go to the county board on the 18th of October. So that's kind of the timeline. Got a lot to do, got some prep, paperwork to get done, try to get a committee date that works for everybody, and we'll go from there. If that doesn't happen, we have major challenges with that, problems with that, we can postpone. Lutheran Social Services has given us at least through the end of this year. And we could probably ask them for an extension if we needed a couple more months into next year or something like that. Questions from the board for last night were basically, do we have any alternatives? Not really. Do we have any other buildings we could buy? Not really. Do we have to do this? Yes. What's the penalty if we don't? Unknown. But we do know that we are required and have been since the 1980s to have a shelter care facility somehow, either to have it ourselves or to contract for it, or to partner with another county. And we don't have another county that has the capability of taking our kids. So anyway, that's the short version. We'll get you the PowerPoint. You'll see the pictures of the place.
That's great.
And any other information that any of you want prior to the end of the month, just give me a holler, let me know. I'll get the information out to you. You will get a resolution, and any accompanying documentation, an agenda item report, for sure before we meet, as a combined group. So I know we don't have a date right now, so you can't say yes or no, but just know that we're gonna try to be putting together a committee meeting. We'll only have one agenda item for that committee meeting. I don't know if we're gonna meet in person. It kind of depends, because we have two committees. Where are we gonna meet together?
Well, that was my question, so it's staffed, right? I mean, it's occupied right now? How many kids we got out there, do we know?
I think like 3 right now.
Is there any time that those kids aren't there? I know one time we went
I
and.
don't know, there's somebody there all the time.
Or they're all-
Depending on who they are.
Are they in school?
Well, yeah, but not every child goes to school. unfortunately.
I mean, I was, at one time, we had a meeting
Yes,
up there,
we've been out there.
whatever. I'm just thinking, if it might not, if we could put it together, it would be nice to have the joint meeting out there. That way both committees could see
We probably could make that.
the
work.
facility. That's what I'm asking, yeah. Cause I
Yeah.
know we toured it once, we had a meeting out there once when kids weren't there or whatever, I don't know.
We
What was-
could probably make it work.
But I'm just thinking that would be, I mean, we could meet here, but it'd be nice to see, have a visual of the building and
Yeah,
have the two
we'll
committees.
try to see if we can.
Look
make
at that, that would be, to me, that would be helpful. If we could do that.
I had a question about the facility. You keep saying it's not locked, it's not a secure.
Right.
The kids are allowed to leave with supervision. What keeps me from walking out that door
So,
on my own?
so in the course of shelter care, if a child would attempt to leave on their own, we can do one or two, we can do a couple things. One is we can, pursue and keep up with the child and try to talk them into returning. If that doesn't happen, we would likely have to get the Oshkosh Police Department in to help us with, picking up the child and returning them. That it has happened over the course of time. It doesn't happen as often as you think though. It's kind of a rare occurrence.
Yeah, I mean, shelter care isn't like, a kid in shelter care isn't probably the same kid that's in security detention.
I understand.
I mean, because
They
they're
may not
probably,
want to be there anyway.
right, they may not wanna be there, but they're not ones, they're not really, haven't committed a crime, or they're not, I don't think they're really dangerous, I mean, they commit
Not
crimes,
dangerous, it's all about have some minor crimes.
minor crimes, yeah, whatever.
But we
but-
certainly would put
Yeah,
it
but like Bill said, I mean, we would try to pursue them, try to sway them back, and we can't, then you call out.
Shelter care is defined in statute very specifically. And it requires us to have it be non-secure.
Right.
So it's just one of the.
And we certainly try to make it a home-like environment. So
Yeah.
Kids are.
So they feel that they're safe and home.
We'll show you we'll give you the PowerPoints. They have some nice, photos in there
Yeah.
of the facility. We can certainly try to set it up to run the meeting there. So everybody has a chance to see the building and the grounds.
Yeah, that'd be great. And we
It's
could,
9,320 square feet. So it's a big building. It's 16 beds,
16 beds, yeah.
and a couple of offices and a couple of great rooms and, it's a big place.
Then they say, I could look on the county board meeting, if you could, but, I think someone asked about the, appraisal, the repairs inside and outside, and then what was the last one, there was 4 things to ask for.
Yeah, and
Oh, the lease, they want to know about the lease.
And the lease,
before.
and I'm gonna make sure, that Mike Elder is my counterpart for the facilities committee.
Right,
He's gonna make sure that they have the
because
documentation.
we had that before, some of the questions come up with that. And then the last thing I got, again, go back to that 4.3, there's no way you can say, make somehow a resolution to return to 33, but you can use 1,000 or a million of this to this.
Gonna have to come by general fund, eh?
I know, but I mean,
So
you
where
know,
the money's gonna come from is wherever, the corp council and the county executive wanna say it's gonna come.
I know, it seems like it. Yeah, the ones I've been with, it comes out of the general fund, And they will decide later if they're gonna take and get a bond or not, and do something, it seems like everything's like that. But that's only because there's such a big pile there, and now they added the ARPA, you know, and now we're gonna have 43, I mean. You know, I'm asking for consideration from us, we already got it, rather than everybody else's pot, they're trying to grab, you know, that's all I'm saying, it just, it seems that we should be able, because we have to do this. And it just makes sense.
It's up to you guys how you do it.
I know, well,
That's up to you.
I'm just answering, but
Oh, that's it.
when I go there, I know kind of what you can do. Yes.
Karen,
Use the chairman. There are already plenty of county supervisors who hear the same thing year after year. Why we end up with this surplus? Because services are given, budgets come through, next year's budgets come through, all of a sudden, the money comes up from 3 budgets ago. I hear this year after year because I say it year after year. They know it, but they don't like the idea that somehow we have this surplus. If we were to suggest that we take this surplus and build ourselves a $3 million facility, whatever, heads would roll, they would go nuts. I don't think you want to approach that,
Well, I'm not saying
because there are
building.
plenty of supervisors who already think human services is some sort of slush fund, taking money for people who don't deserve it. And this kind of thing would be, don't do it, just don't do it, don't suggest it.
So I think the answer to the resolution is they'll probably fashion the resolution, the core council. Puts the resolution together, I'm gonna say she's probably gonna do it similar to how she's gonna do it.
Vicky, you have a question?
Yes, how will you go about determining the date for the meeting? The joint
We
meeting?
will basically probably start to throw out dates to both committees and see like a number of dates and times and hopefully see if we can get something that works for everyone. That's kind of the best. The last time we did this, which was probably 3 or 4 years ago, we kind of just did the same thing, say, could we find a date and time that works?
Doodle? Calendar, anybody
The
phone?
doodle poll.
The doodle, yeah,
Beautiful.
that you can put out there, throw some dates out there and people would come up with the best dates. I mean, I would think that would be the best probably way to do it, is to throw out one of the doodle things. I mean, just throw some dates out there that him and, that Bill and, Mike Elders can get together, you know, with first, you know.
Because I don't know what his committee meets kind of middle month, and I don't know exactly, like, if this is coming up in a week or two, so I don't know exactly when his committee meets. Maybe they'll say, are you guys interested in joining with their committee meeting time? I don't know. I mean, that might be an option too. I just don't know when they meet right now. But I think his meets mid-month.
And then our next meeting is October 3rd.
Yes, and what's kind of difficult, well, first of all, you know, if their committee could meet with our committee, that's another possible time. What's a little stressful about that date is because it occurs the same week as PNF, sometimes we can't get all of the materials ready in time for PNF, and then they have a problem with, you know, we didn't give us enough lead time because the 2 dates are too close together. So that's what I was thinking. We could do it like, you know, toward the end of September. It probably would be best for everybody. But again, I mean, we're gonna try to figure out like a time date that works for everybody. Probably won't be in the evening, probably would be, you know, I don't know if anybody's got like something to stay away from that, like, does anybody know they're going on vacation, in the next, couple of weeks that we should probably stay away from something really good. I know you work, I know there's things going on, so we'll just have to throw some dates and times out there and see what works best for everybody.
Last question. I hope. There was $150,000 to make it public ready. What is that?
Oh, well, I'm trying to, no, I'm gonna explain it poorly because it's a Mike Elder
Okay.
facilities thing, but he said that when a building goes from a private residence or a private building to a public building, there's changes that need to be made that aren't the fault of the owner of the property. They're just things that need to be at a higher code level than what it was for a private facility. So, for instance, maybe there's a change in the steps leading up to the building, or maybe there's something different with the bathrooms, or maybe there's something different with, there is a sprinkler system inside the facility right now, but is it sufficient for public code as a building, as opposed to private code? So he said we have to put in there some monies for this contingency for that upgrade. And so he estimated one of it. So that's what he came up with. And so, because they basically said it's, you know, the meeting was with John, Damo, and Mike Elder and myself. And that's what we came up with, you know, if the building, if we could get a reduced rate on the building, then we have about $300,000 worth of upgrades or bringing it up to both code levels, then that would be about $1 million project. And so LSS in my informal negotiations with them said, we're willing to take a reduction from appraisal. Because I think they want to work with us. I think they want to, you know, they really want to get appraised value, but they were willing to acknowledge that certain things needed to be improved. So, and I think someone last night expressed that they did the square footage, the cost square footage of the other thing. It was like $1 and something per square foot. And I go, boy, that's a really reasonable square foot. And it's fully licensed and it's zone correct. And we already have the license from the state of Wisconsin in our name. Because we were able to get that worked out in this sort of interim process. So really, we're just lacking on that we own the building. And if we don't own it, LSS doesn't want to rent to us indefinitely. They want to just be out of the landlord business. They just want us to purchase it.
The other plus is it's fully furnished for what we need.
Yeah, and it's fully furnished. It's fully furnished. So, I mean, of all the things that could be possible, I mean, this is a really good one because the amount of time it would take for us to get all of those other pieces in place, you could add on easily another 6 months or a year. If you had zoning issues, if you had you know, if you had to get, you know, we're still gonna have, I don't know how we're gonna work around the things that need to be upgraded. But some of the stuff, they can still, you can replace a roof and still have the program running. You don't need to leave the building. So as long as the repairs don't require the building to be empty, we'll be able to work around the changes. Anyway, so I just want you to be aware, we're gonna try very hard to figure out a time that we can make this happen. The only agenda item will be that one. I don't know how long to expect that it will take, you know, given that now you're gonna double the amount of committee members. Maybe it'll take 2 hours or less, hopefully.
But we want to look around this time though, 3, 4, I mean, it's,
Anybody have any?
I mean, I mean, we can't tell the day right now, but we can probably look at the time.
I think.
For everybody.
Like at 3 o'clock in the afternoon,
I mean, yeah, I mean, that's,
or parks.
We're trying to go for later afternoon for most people, is that all right? We try that? Rachel, I know.
It
you're-
depends on the day.
other day, yeah.
Depends on the day. Well, we'll try to do a doodle poll or definitely have
Yeah.
choices and people.
And probably look maybe around this time, I mean, and then we'll have to go from there. I mean, we don't want to get more, I don't want it more, I just want, like, it later in the afternoon, I don't want.
I'll check with Mike Elder too, because obviously he knows his board members and their availability, so we'll, they're a smaller committee, I think they're 5.
Yeah,
Something.
yeah, cause they're a county board, so there's only 5.
Okay, maybe, so
I feel like they're a morning meeting group.
I think they are a morning meeting group, as I remember.
I don't know, last month they met on the 24th, they met last month. So I didn't see them this month.
But I'll check with Mike and we'll get some dates out there and we'll keep on it until we get one. Then we'll do the item agenda report. We'll get the documents that people are wanting to see. Get that stuff out hopefully a week ahead. That's kind of the goal, is to try to make that happen. That's my report.
Right. Anything else for Bill? Alright, Ralph, okay?
No, not this time. Nope.
No. Rachel?
Not today.
Harold?
No report.
Well, the only thing I want to say is I was kind of really, impressed in this year's budget meetings. This is the first one, I mean, that I've gone through that went went as smooth as it did. I mean, it was Ralph and I and Janet and Harold and Bill there, and it was like I said, that the first thing that county exec said is, human services has always been kind of the whooping boy, and we've always taken money from them in years past, we're not gonna do it this time or whatever. And then it was kind of funny, because he goes to finance and he says, did the human services budget meet up to all the expectations or the goals that I put out there? And first, yes. So whatever we did, we met, and whatever Janet and Bill and the staff did, we met. I mean, basically he didn't take nothing away. Like I said, the biggest thing is, I was impressed is he's giving us money because he's taking some from the sheriff's department, giving it to us because he's giving us, their program. So I thought that was kind of neat, Other than that, it was very smooth, very quick. It was ended a little bit quicker than I thought it was, There wasn't a lot of questions, so it's kudos to all you guys, I mean, from department heads and Janet and Bill, for all that you done with it. I thought it was a great, budget presentation, so. So
That was quick and down the line and it would be be nicer to us.
it was kind of easier with Harold, easier than other budgets, wasn't it?
It was actually one of the best budgets I've ever seen, being honest.
Yeah. All right, anything else? I take a motion to adjourn.
Second.
Motion was made by Ralph, second by
Oh.
Harold. That's okay. All those in favor say aye.
Aye.
Opposed? All right, we're adjourned. Thank you all.
See you later this month.
Yep.
Hopefully we'll figure out a time.
Yeah, I can't like,
And we'll see if we can get it after.
How are you?
I think a cop.
Yeah.
I'm sorry, I was like, oh, happy.
Oh, I didn't even.